California.
Let me apologize that, of course, as usual, we're scheduled with two important hearings at exactly the same time, and I will review your testimony later on. But so if I ask a question or two that is repetitive, excuse me for that. Let me just, people are going to the dentist, and you're taking your pictures, or you go to a doctor and they're taking x-rays of you. Is this the type of low-dose radiation that deserves more research?
So when we talk about low-dose radiation, those kind of doses are extremely low, and more commonly, and they're 2 or 3 orders of magnitude lower than the doses that even we call low dose that we're focused on mostly from a computed tomography or nuclear medicine procedures.
So we don't. So one thing coming out of this hearing today is that you're not suggesting that this is a potential danger that needs further investigation in terms of the type of radiation that we are exposed to in the health industry, like medical health.
Well, the topic is very much about doses administered in the health industry. You were speaking more specifically, I think, about dental X-rays or
right.
extremity X-rays, which are extremely low dose. But more commonly, the doses from a imaging procedure, such as a CT scan or a nuclear medicine test, would be also low dose, but at a magnitude that we're really speaking about what would be where research would be helpful to understand better what the potential risks might be. Because at the moment we only extrapolate from high dose exposures to kind of guesstimate what the risk would be at those kind of doses. And
what about is this idea that power lines, I guess power lines wouldn't be, I remember there were some complaints in the past that power lines posed some sort of health threat. Was that due to radiation or something else?
You know, I was on a committee that investigated the effects of electromagnetic power lines, and that kind of radiation, or the quality of radiation, is different than the ionizing radiation that we're talking about now. Now, in fact, most of those studies said that there were no effects from living by the high power lines, but this is a different type of radiation.
All right. What about that?
And it's also a different kind of radiation than the cell phones have as well.
Okay, so you aren't today testifying that a warning to all of us to put this on the speaker rather than next to your ear, or that we better watch out when you go to the dentist, or if you have to get something x-rayed so the dentist or so the doctor can figure out how to help you, we don't have to worry about those things?
So I think what we're trying to say is that the cell phone, that quality of radiation, is something that we're not concerned about here. What we're concerned about is ionizing radiation, and ionizing radiation is dangerous because it breaks bonds, and that's why we're worried about it.
Give me some example of ionized.
So the dental X-ray is a type of ionizing radiation.
Okay.
The other types would be the CT scan, the chest X-ray, what we find in nuclear power plants, what we use for our nuclear power. All of those would be examples of ionizing radiation. They're a type of radiation that causes the breaking, has the potential to break our bonds in our genetic material.
Okay, so is it a fundamentally different type of radiation that we're talking about? I mean, this is...
It is fundamentally different than the cell phone or the power line. Okay. Fundamentally different.
Okay, so we're not just talking about dosage, we're talking about an actual difference in the type of thing that we're looking at.
Right, between the cell phone and the power line and the dental X-ray and chest X-ray and the nuclear power plant, there's a difference. There's not a difference between the dental X-ray, the chest X-ray, the CT scan, and the nuclear power plant. Fundamentally, those are all ionizing radiation, and they're all capable of breaking bonds, which is why there's concern about whether they're dangerous or not. Mm-hmm. As Dr. Brink just mentioned, the dental X-ray is so very, very low. Most studies suggest that, in fact, that's not something that we need to be concerned about, although there are people who will be. But that when we start to get up into like many CT scans, when we start to get up into nuclear power plants, those are things where we might need to think a little bit more carefully about dose.
Well, we do know also, look, I'm here to learn, okay, so don't think less of me for asking stupid questions sometimes. When you go and you're treated for cancer, aren't you being dosed with radiation? And if radiation causes cancer, what are we doing?
So that becomes one of the biggest questions in treatment of patients with cancer. You're absolutely right. The dose we're giving to the cancer to kill it is very, very high. But what happens is high doses kill cells. They don't cause cancer, they kill cells. What causes cancer are lower doses where the cell still lives, but it's picked up mutations. So when you treat somebody with cancer, you give this whopping dose, it kills the cells, they're gone. But around that dose, there's often a lower dose. And then there's the risk of a secondary cancer, a second cancer popping up. But the problem is the person's life is at stake, so you just go in and you treat the cancer because you've got to save the life then, and then you worry about the effects later. But it is a risk. It is a risk.
All right. Well, thank you very much for drawing our attention to this issue. Thank you, Mr. Chairman.
Thank you.